Thank you guys so much for coming out. This is going to be short and sweet, and then you can get back to it. But I just want to thank you first and foremost. My name's Christina Starks. You guys know me because I work with you. I'm going to be presenting my information that I found on my capstone for FSCJ, getting my bachelor's degree. I've done research on ways to prevent ileus after abdominal surgery, which is very close to our hearts since we work on med surg floor and then post-operative floor. So I have a brochure here that I'm going to hand out to everybody. This is what we're going to follow along with for the information that we're given today. So I'll hand these out really quick. Yeah. Okay. All right. So page 1, I plan on handing these out to, the units, the surgical units. And so I did a catchy phrase, chew on this. So hopefully people read it. But it's a guide to prevent ileus after abdominal surgery. So first and foremost, we're going to pan to this first one right here that says, what is ileus? So let's define ileus. It is a temporary lack of muscle contractions in the intestines. So signs and symptoms that we need to look out for our patients is abdominal distension, which is not something we always notice right away on assessment, but most of our patients are aware if they're feeling distended, feeling tight in the abdomen, and then just looking at previous charting to see if there is a change from previous nurses before you on that patient. Decreased or absent bowel sounds, same thing. So we are assessing bowel sounds after with every shift with our assessment. So looking at previous charting or just giving the nurse the next nurse coming on a heads up, hey, it was diminished bowel sounds. Watch out and make sure it's not absent on your shift. Inability to eat or drink and nausea and vomiting, those two go very hand in hand. Our patients come up to us from surgery. We start them on clears. Sometimes it's a little hard to assess because they're groggy from anesthesia, but within 24 hours, they should be able to take down some type of liquid. They come up on clears. So if that is just sitting in their stomach, because that's what ileus does, it decreases the motility overall, then they're not able to digest any of that liquid or food if they're already eating. And it is going to come up or make them feel nauseous. Constipation and severe abdominal pain. Constipation is one, I don't want to get it totally mixed up with this being a small bowel obstruction, but ileus would cause constipation with that abdominal distension. There's the pain there. So next we're going to go over the fun fact or the fast facts at the front here. It says ileus occurs in 10 to 30% of gastrointestinal surgeries. So it doesn't seem like a large percentage, but if it is a small tweak that we can make, then I think that's worth it for our patients. And that's what I'm proposing in this. Ileus is most common 24 to 48 hours after surgery. So that is a perfect time for us to catch that for our patients before they are discharged. Because a lot of our patients that we see, they are admitted because the doctor wants to monitor them further or is afraid a complication may occur. So they want them to stay. So 24 to 48 hours is a good time frame for us to catch that for them. And then the way that we would diagnose an ileus is by x-ray. In the x-ray, you would see bulging intestines. So recommendations, there's recommended guidelines here. And these recommended guidelines come from the American Society of Colon and Rectal Surgeons and the Society of American Gastrointestinal and Endoscopic Surgeons. That's a mouthful. But those are two leading groups that came together to make these recommendations. So many special people that are, specialized in their in gastrointestinal surgery came together to make these. So the first one, these are more so what would happen in PACU. So their recommendation is to discontinue IV fluids after discharge from PACU. Discontinuing them means that we're encouraging our patients to drink and hydrate the natural way, which is just oral. Encourage early mobilization. This is something that we already do on our unit, but we do it. Most of our doctors have post-op orders that say post-op day 1, get our patient out of bed for breakfast in the recliner. Their recommendations is a little earlier. We're pushing patients to ambulate 8 to 24 hours after surgery, preferably on that lower end, like the 8-hour mark. And then this would be the addition into our post-op orders. Patients will chew sugar-free gum for 10 minutes, 3 to 4 times a day. So I know that sounds silly, but there is evidence that backs if patients do this, it increases their gastric motility and decreases the likelihood of them having ileus. So back to our fast facts there, because the other ones are about chewing gum. Chewing gum directly after surgery is a simple way to combat ileus, which we just said. It reduces time to defecation, reporting a confidence interval of 95%. 95% is something that I'm working at right there. That is what we need for our patients. And reduction of time to flatulence and defecation decrease the chance of ileus. So obviously, if your bowels are moving, you're passing gas and you're passing a stool. Reduction and seeing those time and seeing the gas and the stool at an earlier time is going to show us that ileus is not a possibility. The bowels are moving. So next is the new policy. So right here on our brochure, new policy, this is what I'm proposing that we do as nurses to make sure that we can get some research information off of this to see if it's working for our patients. So new policy, nurse responsibility, educating the patient that we will provide a pack of gum and instruct them on the frequency and length. So right after surgery, we always get incentive spirometers. So we're going to also get a pack of gum, tell them that we're going to chew on this for 10 minutes, 3 to 4 times a day. Next is important, the encouragement of demonstration or teach back. So right away after surgery, we're telling them, please drink because we stopped your IV fluids and you need to be hydrated. But also show me that you can chew this gum for 10 minutes. And then we're going to continue to do that daily, 3 to 4 times a day. And then watch them do that. And you just have a conversation with them anyways. You're probably doing admission history, and that's going to take up to 10 minutes. Record the frequency and length of time. So this is something I'm going to work with IT to get so that nurses have a place to chart this. So underneath the incentive spirometer, there's going to be 2 rows. One row is going to see the amount of pieces of gum that the patient chewed on your shift. So that's going to be a free text. You're going to text the number. And then the second square underneath is going to have 2 options there. It's going to say 1 to 5 minutes or 5 to 10 minutes. So it's going to help us with our research afterwards. So I'm going to hand out these quizzes really quick so everybody can take them. All of these right here, they're all multiple choice, boom, boom. Third one is going to be true, false. And then this is just a survey to let me know if this is something that you think is beneficial to implement based off of the information I gave you. And if you learned anything, if I presented it to you correctly. Also, I have a little place that you can write down suggestions or concerns so that I can try to consider that into this project. All right, pass these out.